Thank you for joining our EU-Japan SPS seminar on public health systems today. Audience from all over the world, you're very welcome to be here. Good morning and good evening. We remind you that this webinar is being held in English and Japanese. There is an interpretation function available on the menu, so please select the language of your choice for you to enjoy the discussions. Please do not hesitate to ask questions to the speakers on the chat. We will be delighted to have your comments and questions during this webinar indeed. 皆様、おはようございます。こんにちは。こんばんは。開始前に
Good morning, good afternoon, and good evening, everyone. I would like to give you some housekeeping information about interpretation function. There are simultaneous interpretation services provided in Japanese as well as in English, so please select your preferred language using the button at the bottom of this screen. We have a chat function through which you can submit your comments and also questions. Once again, good afternoon, everyone. Without further ado, let's begin our EU-Japan SPA seminar on public health systems. I am the moderator today. I'm from Health and Global Policy Institute, HGPI. I am CEO of that institute. My name is Ryoji Noritake. Very nice to meet you all. HGPI is a non-profit, bipartisan, independent think tank for public health policies. We are headquartered in Tokyo. We are a multi-stakeholder organization, and we have global participation in discussing healthcare policies. And for COVID-19, we have already started many different discussions. I myself, before joining this institutional think tank, I was a medical anthropologist by training, and with this perspective, I used to work for the international NGO and supported developing countries in terms of how to establish healthcare systems or support disaster-hit areas with their medical systems. And what I felt from that experience is that the healthcare system alone cannot help that area recover. And on the other hand, even if other areas may have recovered, unless there is a solid healthcare system, sustainable life cannot be restored. In that sense, society is made up not just of healthcare and public health, but of many different economic activities. That is why it's very important to discuss COVID-19 through this kind of a series from many different angles and discuss how to recover from COVID-19. It's critically important to apply many different angles. This web seminar is organized under the banner of EU-Japan Strategic Partnership Agreement. This agreement went into effect in February of last year, 2019. And this partnership covers not just the area of politics, but also environmental problems and healthcare. And it is intended to deepen our ties between Japan and EU on global issues such as politics, diplomacy, and social relationships. We share basic values such as democracy, rule of law, and human rights.
The TSD, because maybe there is a potential for visibility and for follow-up that it's not to underestimate.
Sorry, I just hear the voices from background. Can you hear me? Let me continue. Sorry about that. 外交社会関係の緊密化
So it is designed to deepen our ties between EU and Japan. We share the same basic values such as democracy, rule of law, and human rights. And it's very important to deepen our cooperation in many different areas. So we have similar social systems between Japan and the EU. How have we responded to COVID-19? What are the lessons and best practices learned? And what are the areas of future cooperation? It's very important for us to discuss the themes such as public health. Democracy and privacy are the concepts we both have. In such areas, how can we implement such measures such as lockdown on people. We need to deepen our discussions about such measures going forward. From this perspective, we have this series of webinars. This is a 9 seminars series starting from June, ending in September. And this online seminar is on COVID-19 and how to recover from it. And this platform is going to provide information and we exchange opinions. And we will also discuss in this new era of crisis or global crisis, how can we further enhance cooperation between Japan and EU? Today's theme is public health, and we have notable experts in this area, 4 of them here today. I would like to introduce them to you briefly. First, from Japan side, we have Dr. Hajime Inoue, Director General of Bureau of Strategic Planning, National Center for Global Health and Medicine. Dr. Inoue, very nice to meet you. And despite of his very busy schedule, we are happy to be joined by Professor Hiroyasu Iso, President of the Japanese Society of Public Health. Dr. Iso, thank you for joining us. And from the EU side, we have 2 speakers. First, Dr. Ricardo Mexia, Vice President of Infectious Disease Control, European Association of Public Health.
Vice President for European Association of Public Health, Dr. Ricardo Mexia. Thank you very much for joining us today.
And the other speaker from Madrid, from the National Health Institute, we are happy to have Dr. Raquel Yotti. She is a director there at the institute.
Dr. Raquel Yotti, Director for National Health Institute of Spain. Thank you very much for joining today.
Thank you.
さて、本日の構成
Now, without further ado, I would like to explain to you how we are going to proceed with this webinar. First, we'd like to ask Dr. Inoue to speak for about 10 minutes about how Japan has responded to COVID-19 and what are the challenges. He will apply some comparison between Japan and EU perspective. And for the next 10 minutes, Dr. Mexia is going to talk about, for 10 minutes, the situation in EU. And after that, given the presentations both from Japan and also the EU, we will have the 2 commenters making comments. First, from Japan, Dr. Iso, and from the EU, Dr. Yotti will make comments. And the commentators are going to make comments spending around 5 minutes to 7 minutes. So we first have 10 minutes presentation each, and then we'll have commentators making comments, and then that will be followed by the panel discussion. So as for the audience, we have received some questions already submitted in advance. In preparation of this seminar, these questions were very valuable input. And during this seminar, you can actually submit your questions through the chat function. And therefore, please make sure that whenever you like, you submit your questions. Due to the time limitation, we may not be able to address all of the questions, but we will for sure learn from your questions for the future seminars. And I'm sure that those input will be very valuable for the speakers for their future activities. Without further ado, I would like to ask Dr. Inoue to give us his presentation about the situation in Japan. And he will also give us a comparison perspective with the EU. He used to work as a senior advisor at WHO, so he has a very international perspective. I have a great respect of Dr. Inoue myself. I am very happy to be joined by Dr. Inoue, despite of his very busy schedule responding to COVID-19. So I would like to give the floor over to Dr. Inoue.
So do you hear me? This is Inoue. Yes, I hear you very well. Noritake-san, thank you very much for the introduction. My name is Inoue from National Center for Global Health and Medicine, and thank you very much for giving me this opportunity. And I'm now trying to share my slides with you, so please wait a little while. So now my slide is being shared or not? Not completely. I think my slides are here. Yes, we can see your slides. Okay, so according to the theme that was given me, so I'm going to speak rather slowly because we are having this simultaneous translation too, and I'm going to speak in Japanese. So Japan's response to COVID-19, especially in terms of public health, that is my theme. So from our viewpoint, what went well and what didn't work well. On those points, I would like to share with you my thoughts. And also for each of those perspectives, I'm very much interested in the situation and the perspectives from our counterparts from the EU. And I would like to, I'm very keen on listening to your views on those points. Japanese and Japan's public health response to COVID-19, ultimate goal is to reduce the number of deaths. And this graph shows Japan and some EU countries cumulative confirmed COVID-19 deaths per million people. So in this area, Japan, as compared to EU countries, we are seeing a more favorable situation so far, and we are very pleased to see this. And why is this? On this point, there are some possible explanations to this. In Japan, why the COVID-19 death per population is small as compared to that in Europe, and there have been a lot of discussions. There are some hypotheses. There are these 7 hypotheses. First is Japan's response was good in terms of the public health and the medical system. That is the first explanation. The second explanation is it was simply because of underreporting, as I will talk about later. Pcr testing number per population is far smaller than those from the EU countries because we are not testing. So, so the cases are not reported accordingly. The third explanation is socio-cultural factors. We don't shake hands, we don't hug, we don't do kisses, and we wash our hands, or we wear masks. These social-cultural customs may have an impact. Fourth is the ethnic factor. The morbidity rate or the resistance to certain disease may be different depending on the ethnicity. Fifth, which is very interesting, the BCG vaccination, which is very prevalent in Japan, and I hear that that is not so in EU countries. And the BCG vaccination may be useful in terms of protection against COVID-19 for Japanese. The sixth explanation is maybe there was a similar virus outbreak in the past, and which has given Japanese a certain level of immunity. Seventh is the subtype of the COVID-19 or the SARS-CoV-2, which is actually being transmitted in Japan, is different from that in European countries. Actually, there shouldn't be just a single explanation. It should be a combination of these factors, and there is no consensus on the contributing factors. But in terms of the Japanese response, if this is one of the factors contributing to the small number of deaths from COVID-19, then I would like to discuss then what was good and what went well, and what are the issues on the other hand. So I'd like to talk about what works well and what doesn't work well, and I'd like to point out 3 points for each of this, which is now being discussed by many. What works well? Ultimately, it is the basics of public health was adhered to, and this is it. First is the legal framework, which is being adhered to, the infectious disease law and the current law we have in Japan. And within these laws, all positive cases, confirmed cases were assessed, monitored, and followed up. And if necessary, they were taken care of in hospitals, and the costs were paid for by public money. This is the legal framework, and so far, Japan has adhered to this legal framework. And if a person is tested positive, then in the morning and in the evening, every day they get a telephone call to check in, to check whether their situation, and then if need be, they are hospitalized. So we'd like to know the situation in other countries, whether such a legal framework has been well adhered to or not. And the second point is contact tracing. All people tested positive received interview, and they will be asked about their actions and their behavior in the past 2 weeks. And then all the people who have had the close contact with those people were traced and monitored. And there are 470 public health centers across the country. And these public health centers were very good in administrating this contact tracing activities. And the third is the hospital occupancy. In New York and in some European cities, we saw what happened in those hospitals. And the same thing might happen in Tokyo. That was our concern in February, March, and April. And the prefectures in Japan, they try to contact all the hospitals in their administrative regions to try to find out the hospital occupancy. And this is a simple example. Hospital occupancies were monitored and coordinated. So how many mild cases and how many moderate cases, how many severe cases, and what is the vacancy, and what is the occupancy, and which cases should be transferred from which hospital to which hospital. And this type of situation was monitored on a daily basis. So the coordination among the hospitals in the local level went very well. That is the third factor. So these are the points which we think have contributed to the small number of COVID-19 deaths as compared to that in European countries. On the other hand, we do find some issues in Japan's public health response, and we would like to know the European countries' responses to these issues. We are very much interested in knowing about that in this seminar. The first is the PCR testing, and there has been a lot of discussions on this issue in Japan. And this is a comparison between Japan and some European countries. This is a daily new COVID-19 test per 1,000 people in Japan. As compared to EU countries, the number of testings is far below. Why is that? Some people say that this is by design. And so that's how it was designed, because this and that. But on the other hand, there are those people who say that this is just a blunder. This is just an omission by the government. And I personally think the truth lies somewhere in between the two. But it is true that the there are very few PCR testings done, and there were some cases where the testing was not conducted when it was actually necessary. And this is one of the greatest issues that we have to tackle going forward. The second point, it says lack of focused approach. What we call in Japanese night town or the entertainment district. And this graph shows the new confirmed COVID-19 cases trend. The first wave was almost over, but now we are in the middle of the second wave, and we cannot be really complacent at all in the last 3 weeks and 4 weeks. And when did the second wave occur? That occurred from the nightlife district in the big cities, and then that transmitted to other areas, bars and the host clubs and hostess bars and the massage salons and those businesses where close contact between people is inevitable. And this is a photo that I took a few days ago from the Kabukicho district in Tokyo, downtown Tokyo, about 10 minutes of walk from my institute. And this is one of the hotspots. And everybody recognizes that this kind of business area, entertainment area, can be a hotspot, but we cannot close down this type of district. And so knowingly, we could not take the effective responses. And I think this is something of a grave concern from the public health perspective. And in case of Japan, there was this discussion about the lockdown, which was not legally binding. And then we have not conducted the lockdown measures strictly focusing on special areas. This is one of the things that we, the public health experts, think is very much of concern. The third is that we have not been able to utilize the IT information technology, and the typical of that is this fax machine. The younger people may not be familiar with what fax machine looks like, so that's why I took this photo. I took a photo of this fax machine, which is operated and which is actually used in the hospital, which is used every day in daily activities. And although we have the latest, state-of-the-art IT technologies, but at the same time, we are using this fax machine in reporting the cases because that is required. So this is a very inefficient analog communication technologies we have to use in taking the responses to the infectious diseases. And on the other hand, this type of contact tracing application, which is being introduced in many countries, also in Japan, but this has not been used by many people yet. In order for this kind of application to actually function and work, majority of the people have to download this and use this, but in Japan either, this type of application is not widely used. So how well we can utilize the IT technology, that is another area where we have the issue in Japan. So I talked about the Japan's public health response. In terms of the mortality, it may look very good, but and if the Japanese public health policy has contributed, then these three are the major contributing factors. But at the same time, as I explained just now, and we have these three issues at least. So I just talked about the those things that went well and those things that didn't work well in Japan in terms of the public health. responses, and I'm very much interested in knowing on how the EU countries are working in these elements. Thank you very much.
Thank you very much, Dr. Inoue. Thank you for your very comprehensive explanation of the situation here in Japan. You presented 6 perspectives, what works in Japan. Number 1, legal framework. Second, contact tracing, which includes cluster response, and also hospital occupancy monitored and coordinated. And what needs to be improved in the future, what we can learn from the EU is expansion of PCR testing and also more focused approach to address the entertainment district and others. And yet another one is how to share information, how best to use IT devices. Thank you very much for your very comprehensive presentation. I really appreciate it. So now from the EU side, we would like to have the first presenter. I'd like to switch to English to introduce the first EU speaker. Are we hearing Dr. Messier's kid's voice?
Now on the virtual stage, we'd like to have Dr. Ricardo, Vice President of European Association of Public Health.
Yes.
Dr. Mushia is a public health doctor and at the Epidemiology Department of the National Health Institute in Portugal. And he currently is the president of the Portuguese Association of very honored to have you here, Professor Mushia, and the floor is yours.
Good morning, and I'd like to greet all the speakers at the panel, and also thank the invitation on behalf of the European Japan SPA to be here and share some of the views from the European perspective. EUFA is actually a broad organization in Europe, so it's actually a federation of public health associations from the different countries. So we do have very different approaches. So it's, I would say it's not as simple as Dr. Inoue's task to sort of describe the broad scope of different measures that we do have in Europe. Nevertheless, I'll try and do my best. And of course, I think that the comments from Dr. Iotti will also probably add value to what I eventually might be able to share with you. So I'm going to share the screen. So mostly, this is, I'm quite a fan of this article by Thomas Pueyo, where he describes what needs to be done in order to face the pandemic with the hammer and the dance. So what he means is that the hammer is something that we must do on a very sudden perspective and to contain the situation at a very early stage, because otherwise we'll have a steep increase in the number of cases if we do nothing to contain the pandemic. So the hammer is really what we needed to do, sort of to flatten the curve. That was a need we had, particularly because none of the countries throughout the world was really prepared to contain the pandemic. So we really needed to buy some time. So flattening the curve gave us both the possibility to prepare for the next steps, but also it enabled the number of cases not to be concentrated in a specific time that the health services would be overwhelmed. So that was the initial response. And then afterwards, we really need to reassess how the epidemic situation is going on. And then there's the dance part. And the dance means that you need to be reacting to the different situations that start to arise. So sort of a need to move forward and backward with the measures in order to face the pandemic. So this is actually, I think it's a very good metaphor on what needed to be done and what also needs to be done at the current stage. And to further present that, this is a chart where I selected a few European countries And in gray, you'll have the other countries throughout the world. But I've selected some of the biggest countries in Europe, and also the Portugal and Sweden for reasons I'll further detail. So what you can see if you compare this graph with the previous one is that indeed there was a steep increase in the beginning, that first wave that was already mentioned, and then we did have a decrease in the number of cases. But what we're facing now is actually either a second wave or a steep increase in the number of cases, and that is something that's certainly worrying the European countries, and we're trying to address the situation. There's a lot of concern about the traveling now, because so far there's been a lot of limitations on the travel, and as we open up the countries, there's the risk of importing cases from different settings where the situation is still a bit complicated. So as you can see from several of the countries, so both Spain, Germany, also Italy, they're now facing an increase in the number of cases, and that's also a bit complicated. I've included Sweden because from the European countries, it's one of the most diverse approaches that we've had, and I think it's quite unique even at the global scale. So Sweden has had very few limitations. They've tried to approach the situation on a more trying to achieve herd immunity. So they've sort of implemented some measures, but tried to make sure that they tried to protect the more vulnerable ones while allowing the least vulnerable ones to sort of have more near to the regular behavior they would have. And of course, as was already mentioned by Dr. Inoue, also culturally, there's differences between the southern countries in Europe, where, as was mentioned, we all like to hug and hang out with different people, and that families are usually a bit larger, and the difference between the situation with the northern countries, which tend to be a bit more distant, and they have culturally different behaviors. So in what happened in Sweden is that indeed they have a higher mortality rate than the other countries. Even if you compare with different Nordic countries, which had a different approach, they do have a worse record when you analyze the mortality. So it was quite interesting to follow also the Swedish situation. So I'll go back to showing you the situation currently going on. And as you can see, it's also quite heterogeneous across Europe. You'll have some settings where the situation is mostly under control, but then there's some particular spaces where you can see that there's active transmission going on, both in the Eastern Europe, the northern region of Spain. Sweden is still struggling to get the numbers down. For instance, you can see a very dark spot here in Portugal because it's a very specific situation in the outskirts of Lisbon. So there are very specific contexts where you probably need very focused approaches. And I'll go into that in a little bit further. But Dr. Inoue already raised that issue of the need to have focused approaches for very specific contexts that face very specific risks. So the EU is an organization, the European Centre for Disease Prevention and Control, that usually does a risk assessment. In the more recent risk assessment, they've identified these 6 goals that need to be achieved in order for us to contain the pandemic at its current stage. So one of them is the need for a robust monitoring framework. So we do need to have an information system in place that enables us to detect any changes in the trends, and that we can, if we detect those changes, we can quickly and swiftly have an intervention to face those changes. And these frameworks are fundamental for the decision taking, and also for the stakeholders to know whether or not different approaches needed to be taken. And the second issue that is raised is the expanded testing strategy. Dr. Inoue also mentioned that eventually that was one of the pitfalls from the Japanese approach. And in Europe, we do have very diverse situations. We have had countries with very aggressive testing procedures where there's quite a broad number of tests being done, while other countries have been much more restrictive on the approaches for the testing. But still, we need to be on our toes with the testing strategy and being able to expand when we do need it. And in the beginning, there was, of course, limited capacity to test. And as the situation evolved, we, of course, increased our testing capacity, which, of course, was quite significant. And now we need to be able to scale that testing strategy, that testing capacity, whenever we find that there's an increase in the number of cases. And some countries are actually testing contacts, others are only testing symptomatic patients. So it's also quite diverse, but still we need to expand as the pandemic evolves. The third aspect would be the contact tracing framework. And this is essential for good control of the pandemic. We do need to swiftly identify cases and then identify who potentially might be in danger of developing the disease through contact with those cases. And indeed, there's the need for a very specific approach to go and test those situations in a very detailed manner. So we need to go and swiftly identify those contacts and put them in quarantine. So they need to be isolated from patients because we know there's a significant asymptomatic transmission. So the contact tracing is also essential. Then we need to promptly investigate clusters or outbreaks. And that's particularly needed in specific contexts. And Dr. Inoue mentioned the nightclubs, and in many countries in Europe, those are not open yet. So there's no nightlife, so clubbing is not allowed, but still there's other clusters that we need to address. Nursing homes are particularly concerned. We have prison facilities where also we've had some concerns. There's also the occupational hazards. There's been a significant number of outbreaks in meat processing factories, for instance. And then we really need to go into those cases and swiftly identify them before they reach exponential growth. We need to have a long-term implementation of non-pharmaceutical interventions. So the different measures that concern social distancing, the need to have the use of masks, and hand hygiene on a thorough level is actually quite significant. So we need to make sure that those measures are maintained on the long term, because what might happen is that once we start having those measures for some time, people might tend to not use them as often as they did. So this is something that's also some of the countries are struggling. And the final issue I would raise is the need for strong risk communication. The situation is mostly dependent on the behaviors of individuals, and therefore the ability to communicate to individuals the need for them to implement these measures is fundamental. And also something that's sort of been an issue, especially now in this beginning of this second wave, is that people might have the perception that it's already over, so we can go about our normal lives. And that's not the case. So we really need to be very assertive on the way we communicate risk and let people know that they can go back to some of the activities if they have certain care and if they use some of the measures that are already available. Otherwise, we'll probably be facing a difficult situation, and in particularly in the next winter, where things might be a bit more complicated everywhere. So these are some of the approaches we've had here in Europe, and I'll be looking forward to discuss this further with the rest of the panel and also with the participants. Thank you so much.
Thank you very much, Dr. Mushia. Obrigado. Thank you very much for such a comprehensive explanation on situations in EU. And indeed, situation is plural in EU. I think each country and region might have different story in EU nations. And thank you very much for sharing that perspective as well. Also, Dr. Mushia kindly mentioned that next steps for EU, such as monitoring framework, testing strategy, contacting tracing framework, cluster investigation, or non-pharmaceutical intervention, etc. And some topics indeed echo with what Dr. Inoue mentioned, and I already see some common challenges and and actually potential collaborations points between Japan and EU. So thank you very much for sharing your insights and foresights. Appreciate it. Now I'd like to ask Professor Iso for his comment, and let me change to Japanese. Iso 先生、今、2つの発表が
Dr. Iso, thank you very much. We've just listened to 2 presentations. Now, I'd like to ask Dr. Iso to make comments on Japan's response and also EU's response. He is president of the Japanese Society of Public Health, and he is one of the prominent scholars in this area. His expertise lies in the area of public health, and not only that, chronic disease management and prevention and epidemiology. We are both aging society, Japan and EU, and aging society in relation to COVID-19 in this area will be able to get valuable input from Dr. Iso, and how the academia worked with the government and what kind of public health resources do we need in the future. These are the areas that he has made great effort in the context of COVID-19. I hope that Dr. Iso is going to introduce his perspective, objective stance from the government, from the expert perspective. So once again, thank you so much, Dr. Iso, for taking part in this webinar. There will be 1-page slide to be presented from the Secretariat. Dr. Iso, the floor.
Thank you very much for the introduction, Mr. Noritake. So we heard 2 speakers and 2 presentations. And as the president of the Japanese Society of Public Health in Japan, especially what Dr. Inoue talked about, what has worked well in Japan, that is the legal framework. And also, in the last 30 years, the number of public health centers was halved because of different political reasons, and 470 public health centers right now in Japan, but they did thorough contact tracing, and they conducted the thorough triaging for hospitals. But this is a success side, but because of the increase of the COVID-19 cases coming from the nightlife districts, so the work involved in the contact tracing for those increasing number of COVID-19 cases is increasing. And from the Japanese government has requested us, our society, and also other societies for nursing and other experts asked us to cooperate in increasing the capacity, human capacity. Right now, we have solicited the personnel who can work for the public health centers. And the Japanese government has, for the first time in history, has initiated this framework to employ such new personnel as the part-time workers in the public health centers. And this scheme has just started, and now the additional people are now working in the public health centers. This can be a good measure in terms of the temporary measure, but once the COVID-19 increases in cases, then we will need the long-term measures. So that is explained by this slide. At the bottom, you can see the human resources development and so forth. In the peacetime, before this kind of pandemic occurs, we need to institute this kind of training for medical internship trainees. And then the social science experts, certified physicians, and we have such mechanisms to train these experts, and these people need to be trained for health emergencies. And then infectious diseases specialists, FETP, This is something that is conducted by the US CDC, and we have a Japanese version of FETP, which is run by the Infectious Diseases Research Institute, and IDES. This is also a training program. 5 people each year train under these programs, but this is not enough. And it is not just the physicians that we need. We need the public health nurses. And it's very important to mobilize public health nurses. So in the nursing schools in the universities, and there are experts on public health nursing, but they're very busy with teaching. And so in such a situation, we need to ensure the specially appointed professors and teachers who are employed in a fixed term. And so these people who are employed a fixed term in the universities can be mobilized in this kind of health emergencies. And then WHO headquarters and UPLO and the US CDCs need to be coordinated from us. So through training these personnel, we need to work on the middle range issues, quarantine stations, public health centers, and the medical institutions, and the local institutes for health. We still, need people for these institutions, especially some physicians have to work in different institutions. So it's important that we appoint people, the same people, to different positions in different institutions, and thereby ensuring the personnel. And whenever the emergency happens, we need to create a headquarters, or whether this can be this is a new organization or the headquarters, which is composed of the national centers of the infectious diseases and the national research institutions, can be combined to compose the headquarters. And which way we should take, that is the matter of discussion for the future. But this headquarters should connect the national government and prefectural governments and build the very good data. And the communications is very important, as was pointed out by our 2 previous speakers. And ultimately, these should be fed into policy recommendations. And 10 years ago, when the new influenza urgent situation occurred, we did not experience a very severe cases of the situation of the SARS, not like in Korea or Taiwan. And that is why we were not able to create such a mechanism. But we are facing this pandemic, it is important that we create such a system and also train people.
Dr. Iso, thank you very much for your very comprehensive comment on the current situation in Japan and the future policies. In terms of response, oftentimes we are good at responding in Japan, but preparedness, we may not be as strong. So we are still in response to COVID-19, but we need to have infrastructure or foundation for public health, including human resources and also communication. We have already received a question about communication, how to communicate risks. The importance of infrastructure going forward, that is something that has been identified with his proposal. Thank you very much. So from now, I'd like to introduce Dr. Yotti from the EU.
Thank you very much, Professor Iso, for such a comprehensive comments on the Japan situation and the future prospects. Now I'd like to introduce Dr. Yotti, Dr. Raquel Yotti, as EU side commentator. Dr. Yotti is the current Director General for the National Institute of Health in Spain, the main public funding organization for biomedical research in Spain. And Dr. Yotti is a clinical cardiologist and also associate professor at the Carlos III University in Madrid. If you have overall comments reflecting all the presentations, it'll be highly valuable, and perhaps maybe you can kindly share your perspectives on how EU is successfully managing the crisis, or how challenging it has been. Dr. Yotti, floor is yours. Thank you very much indeed for.
Thank you, Mr. Noritaki, for your kind presentation, and congratulations to all the speakers for your brilliant presentations, in which we have learned that we share challenges in Europe and Japan, and it's very important to share experiences as well. So, as Mr. Noritaki has mentioned, the National Institute of Health in Spain is a public funding organization for biomedical research, but also is a public health institute. So our mission is, we are two principal missions. On one hand, in research and innovation, and on the other hand, on public health, providing public health services. So for us, it's very important to recognize that all the public health measures need to be supported by science. And we think that during the COVID-19 pandemic, the close interaction between science and public health has been widely recognized. We believe that science and innovation focused on patients and on public health is crucial to respond to a global crisis caused by an infectious disease or other emergency threats. So from our institution, we have been working, trying to give evidence for a better decision making. And I think it's interesting to elaborate on this role of science in the preparedness and also in the response capacity of the countries. As you may know, Spain has been one of the European countries hardest hit by the virus. And we have learned that one of the factors is related to the high number of travelers we received every year. We are, as you may know, one of the most important touristic destinations in the world. So we suffered a massive entrance of the virus, and post-COVID genetic analysis performed by our National Institute of Health has shown that at least 15 strains of the virus had been imported at late February, but at that moment it was very difficult to identify mild and asymptomatic cases, so community transmission was not evident until the second week of March. So it was a real challenge we have to face, and maybe it was similar to the situation that happened in Italy, for example. And this was a situation in which we had to respond, and we think that the lockdown, the strict lockdown that was decreed on March 14th by the Spanish government was a very critical point for success, if I can say success, because we are still fighting the virus. It was very important for prevention and control. Also, I'd like to mention, like as a success point, the Spanish health system is an universal and free access health system that is available for the whole Spanish population, and we think that universal coverage is a key factor in public health, especially in a situation, in that kind of crisis situation in which we need to reach the whole population. regarding the other challenges we had to achieve, I think is important to mention that in Spain, and is similar in Japan, we have a very elderly population. So we know that the old people has been more vulnerable to the virus. So we had a real difficult situation in nursing homes. And I think it's very interesting to learn from the experience from Japan, because we have similar demographic characteristic, and despite these similarities, it's interesting to know about the different impact and mortality on the elderly people in Japan. So maybe it's interesting to deep into the different system to take care of our elder citizens. And to end this comments or reflection, I would like to say something about the response in terms of research and innovation specifically. I think that Spain react very fast to the pandemic in that field, and the rapid response was the main action was a plan against COVID-19 that includes 30 million euros for for proposals for projects intended to provide an immediate research and innovation response. We at our institution evaluate more than 1,500 proposals, and now we have 130 research projects ongoing. And these projects are giving us very important responses, very practical responses in several fields, including development of innovative therapies, characterization of the virus, knowledge on the genetic and antigenic variation on the SARS-CoV-2, as well as the immunological response, and also vaccines development. And in the field of epidemiology, I think I'd like to underline one of the studies we think has been most important, providing information for public health, not only in Spain, but I think for other countries, that is the Spanish COVID-19 zero epidemiological study. As you may know, this study has been recognized as one of the most interesting studies in this field in the world because of the design. It's a population-based and national-wide study that whose results can be inferred for the whole population, and has provided a very interesting figure data on the whole population that has been exposed to the virus and has developed antibodies. So we think this information that has been published in Lancet recently is one of the examples of the importance of science and innovation to provide data and that can guide our response to this pandemic.
Thank you very much. Thank you very much, Dr. Yoti, for such stimulating and also very encouraging comments for Japan and EU. You kindly mentioned about the importance of the evidence-based scientific approach, and that's something you provide for Spanish society. And interestingly, you mentioned that lockdown policy as successful model in Spain in March. And also you touch upon the importance of UHC, universal health coverage, or national health system as a basis infrastructure, basic infrastructure to tackle down this infectious disease. And also you kindly mentioned about the important aspects of comparison between EU and Japan and collaboration points between EU and Japan about aging population, how Japan handled this situation so far. And finally, research and importance of research and innovation. We need an innovative approach for this global pandemic, and thank you very much for mentioning about that. Now we have about 27 minutes for the panel discussion, and the questions from the floors are highly welcome, and also questions among the speakers, panelists are also very welcome. And this is one of the opportunities that how EU and Japan can learn each other. And the language, we have a simultaneous translation, so we can switch and switch. I'm happy to speak in Japanese as well. Firstly, let me introduce some of the comments from the comments or questions actually from the floor. One is about PCR testing. The Europe increased the number of PCR testing, but on the same time, that will bring extra burden to the agencies or authorities to trace the population. How Europe has been handling that? That was the question. And also risk communication. Dr. Mushia mentioned about the risk communication and how Japan is implementing this risk communication. And also, one question is about the lockdown. Why Japan cannot implement the rigorous lockdown, and still the Kabukicho, the entertainment district, is still vibrant. So those are the comments and the questions from the floors. But let me start actually with the question regarding about the lockdown. If it's okay to Dr. Inoue or Dr. Iso, what's the challenge for Japan? Why we cannot implement rigorous lockdown? And I'm happy to receive your personal comment, not to represent the organization or anything, but your personal comments on this. ちょっと日本語でも簡単にフォローしますと、なぜ日本で
I'd like to just give you a brief explanation of what I've just said. Why is it that a very strict lockdown has never been implemented here in Japan? Your personal views, Dr. Inoue or Dr. Iso, please.
Please unmute yourself. This is Inoue. As for the lockdown, my view, so I'd like to share with you my view. First of all, why Japan has not been able to implement the lockdown. The first wave, when we had the first wave, we did not institute the lockdown because the milder lockdown would be able to contain was able to contain the first wave. And if we can, curb the wave, then it's better to have less restrictions on society, and we were able to control the first wave without the rigorous lockdown, and we actually did not need such a rigorous lockdown. But as for the second wave, we have a different situation. Even without the lockdown to be applied to the entire country, but the lockdown on specific areas could have been effective. Entertainment district occupies only a small fraction of the Japanese economic activity, probably less than 1% of Japanese economy. But this 1% of the economic activity has been the hotspots for the coronavirus cases. So if we institute the rigorous lockdown on those areas and then allow the other areas to be economically active, I think that was one option. But that was not possible because it was not because of the mistake in the judgment, but there is no legal framework that will allow us to do that currently. That is my understanding. So we will have to revise the legal framework that we have in the future. That is my personal view.
Thank you very much, Dr. Inoue. That was very clear. Dr. Iso, anything you have to say?
I have no further comments. It's Dr. Inoue.
Thank you very much, Professor Iso. I would like to actually have the same questions to European delegations that, from the same perspective. How Europe successfully implemented this lockdown? This is very vibrant democratic countries in Europe, and sometimes it's very challenging to implement a top-down approach. What was the narrative or successful communication between the public health experts to the general public? If you have any comments on that, Dr. Mushiya or Dr. Yoti, that would be highly welcome.
I think that in the beginning, that was the possible approach. So indeed, the lack of preparedness and the situations that were unfolding in China and then in the different European countries actually gave a strong message that something needed to be done. So disruption that was caused by the lockdowns was actually quite significant. I mean, there's a significant economic impact from those decisions. And now, as we're getting back to some of the activities, so there's been a gradual increase in the number of activities that can actually function. We've seen that people are adjusting. So we needed some time to actually adjust those activities. But it's not, I would say, it's quite controversial. There are significant groups that defend that this should not have been the approach, and that the impacts of these lockdowns are even bigger than what was able to be controlled by these lockdowns. So there's sort of still some conflict about this issue. We believe that there was a lot of uncertainty that we needed to address, and therefore some measures were needed to be more cautious in the beginning. We didn't really know the disease, so we needed to be more cautious to prevent situations to unfold in a very negative way. So I believe that more or less the communities were here in Europe quite receptive of the approaches. There was, of course, some people who did not agree, but I think that even before the legal lockdowns, a lot of the population was already doing their own restriction on social contacts. They were already staying at home. So I think that it was more or less a consequence then to implement those lockdowns. And as I mentioned, it's quite diverse across Europe. I mean, it's quite different what happened here in Southern Europe than what happened, for instance, in Sweden or in the UK. So the difference between the countries is also quite significant. But still, I think that was the option we had. And what has been the message throughout Europe is that eventually we will try to prevent the need for those lockdowns in the future. So we're trying to design solutions that prevent the need for those future lockdowns. And if we do need them, we'll try a more focused and targeted approach. So either specific activities or specific regions will undergo this sort of very drastic, very generic solution.
Thank you very much. That's a very reasonable and the rational explanation. Do you have additional comments from Dr. Yoti?
Yes, thank you. What I want to say is that lockdown is a very hard measure. So I perfectly understand that if in Japan it wasn't needed in the first wave, the right thing to do it was not to use the lockdown. The second thing I'd like to mention is that here in Spain and in other countries in Europe, we do have a legal framework that allow us to use that kind of measures. But actually, it was something that we maybe never thought we would need to use. It was just something that we had in our constitution just in case sometime we will need to use it, and we had to use it. And I think that for that people that is even nowadays critical with the use of that kind of measures, I have to say that from the data from the zero epidemiological study in Spain, we know that only 5% of the population was exposed to the virus. And even with such a few number of people exposed, we had a system that was in some places, in some cities, was overwhelmed. So if we hadn't used the lockdown for the whole nation, we can't imagine the number of lives and the impact that the pandemic will have in our population. So for sure, I can say for everyone that is still not sure that the lockdown was the right thing to do, that it was crucial. And of course, for the next waves and actually now we are using a different approach that is more surgical, I can say, is intended to use lockdowns or quarantines just in the places, just in the in some areas where it's needed. But I think it's important, the take-home message, that when lockdown is needed, we need to use it.
Thank you very much. So indeed, the lockdown policy is sort of a restyle weapon, and without the need, maybe we should not use that weapon. Just the comments from audience just came in that, as Dr. Yoti mentioned, the data is quite critical. That how we can correct the rigorous data, scientific data accurately is quite important to develop the policy, public health policy. So audience, thank you very much for that comments as well. I would like to have two separate questions. One is to EU side about PCR testing strategy. This is actually original question from Dr. Inoue, that how EU boosted the number of testing and what Japan can learn from EU. I believe that particularly Spain, that PCR testing has been increased rapidly, and how what kind of policy has been implemented. I think that was original question from Dr. Inoue. And also to Japanese side, I would like to reflect the comments from Professor Yoti, Dr. Yoti, about aging population. How Japan successfully so far handle the sort of pandemic within the risk population, which is aging population, and the Japan is the most aging nation in the world. So firstly, let me start to the question to EU side about PCR testing strategy. How EU successfully can boost the number of testing. Dr. Mushia or Dr. Yoti, if you have any comments on that, your comments would be highly valuable.
I can start. Well, I have a very broad view of what happened throughout Europe, but I have a more detailed view on what happened actually here in Portugal. And I think that initially it was the same. So we had very specialized centers where both the diagnostics and the treatment of patients was taking place. So we had the national reference labs were the ones to first develop and implement the techniques for the PCR. So all the samples actually were directed towards the national reference labs. It different hospitals were actually developing their solutions in order to also be able to do the PCR sample. But as well, there was a very important role for the private sector here in Portugal. So a significant number of tests were actually done in the private sector, and the response was quite interesting. And they actually came up with very innovative solutions that I'm sure you've already seen, such as they implemented special lab collection centers, both in schools in different settings that were, of course, during the lockdown were not being used as such. So they used those facilities to do the sampling, and they actually implemented a very interesting solution, which was the drive-through. So people would just be in their cars and they would be able to take the swab without leaving their car. So this was both very practical, and also from the security point of view was also an interesting quite interesting. So this was actually the way that we sort of scaled up the lab capacity. This is mostly how it was done here, and I think that different countries did that at different speeds. So I guess that nowadays it's quite widespread, the number of
I think the reception is a little bit weak from Dr. Muhia. But thank you very much for your valuable comments. It's on about public-private partnership and how innovation can be increased and developed from private sectors as well. Professor Yoti, Dr. Yoti, do you have any comments in addition to that? Can you unmute? Sorry.
I'm so sorry. Just a short comment to add. Here in Spain and in other countries in Europe, there was another factor that was critical, and was the support to the national industry for manufacturing PCR kits and for the distribution to the national health system, to the hospitals. At the beginning here in our institute, we are actually a referral center for microbiological testing, and also for COVID, for sure. But we also, from our institution, provide our scientific services to the private sector to boost the development of PCR kits. And I think it was very important to have more products that were available for the distribution to the hospitals.
Thank you very much, Dr. Yoti. That explains very well about the situation in Europe and how Japan can learn from EU, actually. Thank you very much. So that my question was to, yes, please, Professor Issa, please.
It's one of the reasons for Japan we cannot increase PCR testing so far is I heard in the European country, for example, France, introduced auto analyzer for PCR auto analyzer from Japanese company, but the Japanese government did not, agree to use such an auto analyzer because something is a difficulty in our Japan is assurance of such a new apparatus it takes long to approve such use of such a new machine, and also in the early stage is some of the PCR agent is we rely on the import from abroad, China, European, US. So we did not have a large stock of agent to test the PCR. So machine and agent, and we also by manual testing. So we need a lot of personnel, laboratory technician. So that's this situation to delay increase of PCR testing in Japan.
Thank you very much for that explanation, Professor Iso. Indeed, we need innovation introduced here. Maybe not to use the facsimile machine anymore. I haven't used that machine for maybe like 2 decades or something. But let me anyway go back to the aging question to Japan side. How Japan successfully so far, let me say so far, protect our aging population? That was originally Dr. Yoti's question. Either Professor Iso or Dr. Inoue, would you please? 日本語でもぜひお願いいたします。
Inoue is the right person to explain.
井上先生、それではなぜこの高齢者の感染
Dr. Inoue, why is it that so far Japan has been successful in protecting elderly population in COVID?
してもらっていいでしょうか。
Thank you for your questions. I think this is again strictly following the very basics of public health principles. First, wearing mask all the time. Second, hand hygiene. And third, checking body temperature every morning and afternoon. Many Japanese senior populations and their care actually follows these 3 very basic the principles. And in my understanding, the high prevalences of these, the following of these 3 basic principles actually worked well so far. Thank you.
Thank you very much, Dr. Inoue. Very basic approach. Yes, please, Professor Iso.
Sorry, it's I agree, Dr. Inoue's comment. And the other thing is in a Japanese custom habit, and we don't hang each other when we meet. And also is we have some custom to bow each other, but naturally we have a social distance, 1 meter or 2 meters with under the conversation. So that's the Japanese habit is may help to reduction of infection.
Thank you very much, Professor Iso. Do you have comments, Dr. Yoti?
No,
okay.
Thank you.
Thank you. That basic sort of a tradition and a custom indeed matters. My background is medical anthropology, and that's, I think, should be taken into consideration. Well, myself study in Netherlands and lived there for years, so I personally do these things, and maybe I'm making the situation worse in Japan, but still, the custom matters. And even before the COVID-19, I remember that many places in Japan actually had the sanitization spray, so that it's not something new to Japanese society. Of course, it's more visible here now, but indeed, the sanitization mindset really matters, I think. We only have 5 more minutes to wrap up this discussion. So would you please say one phrase, one last statement about what is your expectation between Japan and European collaboration to learn each other on this public health matter? Would you start, please, Dr. Mushia, please?
Oh, thank you. Well, I certainly think that, as was already highlighted by Dr. Yoti, that this is a very important field to share information. So it's fundamental that science plays a role, and therefore it should know no borders. Science is probably universal language. So we should all be able to share good practices and the science that surrounds those good practices in order to evolve and to find the best solutions for each context. I'm sure that some of the solutions make sense that are used in Japan make sense here in Europe, but others might not be adjusted to the cultural or to the health system. But still, I think we can certainly share those views and learn from one another. And these exchanges are very, very important. So I would also like to congratulate the initiative of this webinar, so that these bridges that we build across continents surely play a very significant role. And for UFA, certainly it's very important to share the values of science and the values of protecting the public's health. So therefore, once again, thank you so much, and I'll be looking forward to further collaboration.
Muito obrigado. Thank you very much. Dr. Inoue, would you mind start? ごめんなさい。もう一度アンミュートにしていただければ。
Thank you very much for conducting this webinar. I think it's quite informative and important for us to share the information. How are we doing each other? And I think we can learn a lot from the experiences from our counterparts. And actually in this session, I learned a lot, and this could actually facilitate our response starting from today. And I really appreciate this informative the sessions, and really hope this could be conducted in a routine manner in the next several months to go. Thank you.
井上先生、ありがとうございました。大変ご多忙のところにもかかわらずご参加いただきましたことを改め
Thank
て。
you very much, Dr. Inoue. I really appreciate your taking time.
Dr. Yoti, do you like to have a final comment, please?
Well, what I have to say, first of all, is that it's been a privilege to share this virtual table with all of you. And I think that it's been very clear in this session that we need to collaborate. It's not a recommendation, but a mandate that we should put in our agendas. And it's important to see that we are observing very rapid and coordinated responses all around the world. And we now are seeing that these coordinated responses are making a difference. We are going to see in the next few months that inequalities are going to deep, and we need to be prepared, because inequalities on accessing to the health system, on the impact that the crisis, the pandemic has had on the population, will need a coordinated response from the countries. We know that, for instance, a few months ago, it was difficult to imagine that we were going to work together, for example, in Europe, to get a vaccine. And now we are seeing that it's happening. So we need to use this coordinated response, this situation that we have built together, and use it to go further in multilateral collaboration. Thank you very much for inviting me to this workshop and for sharing your reflections and your ideas. Thank you.
Dr. Yoti, thank you very much. The pleasure and honor was ours. Thank you very much. Finally, Professor Iso, do you have the final comment, please?
Yeah, thank you very much. There's a lot of information I got, and one thing I need to add to this session is that Japan is, because of this pandemic, Japanese society have some opportunity to change some aspect of society, because one is this pandemic stimulate stimulate remote working in company, and that is a good aspect, because a young man is accumulating in Tokyo and Osaka metropolitan cities, but local cities is new young generation is going out, but such a remote working back to the local community, local prefectures. So this is one good way. The additional custom to use a seal, hanko, is this disturb efficiency of documentation in every aspect of society. So I think it's two aspects is maybe incidentally this pandemic improved some aspect of our society in Japan. Thank you.
磯先生、本当にご多忙のところご参加くださいましてありがとうございました。Thank you very much for joining us today. これで18時になりましたので。
Thank you very much. It's 6 p.m. in Japan, so I'd like to conclude this seminar. I'd like to just say a few words. EU and Japan. We are experts of public health. How we experts should communicate measures such as lockdown, which restrict people's activities. It's very important to provide a thorough explanation to our people. This is even a philosophical or ethical problem. We have to strike a good balance between overall happiness and each person's freedom. That's why we need to thoroughly explain and communicate our rationale. As Dr. Yotti said, social determinants of health in pandemic situation or infectious disease situation, we make those people vulnerable, even more vulnerable. And so we need to have full consideration towards those people. And this is another area of cooperation between EU and Japan. We are a matured democracy. We have civil societies in Japan and also in the EU. That is why, rather than having just top-down approach or simply unilateral bottom-up approach, we need to make sure we strike a good balance and have good communication with our people. So we are sure to be able to learn from each other, and that is for the benefit not just for us, but also for the entire humankind. So I'd like to take this opportunity to thank Antonio and also Yamamoto-san from the Secretariat as well, and of course, the speakers. Thank you very much.
Thank you very much. This is the end of this session.